everyone, I am Dr. Sana, practicing gynecologist and MRCOG qualified doctor. If your MRCOG Part 3 exam is coming soon and you're wondering how to plan your last 2 months of revision, this video is for you. I've created a structured 8-week revision plan based on the latest MRCOG Part 3 exam format as updated by RCOG. So we'll cover what to focus each week. So grab your notebook, let's make your next 60 days count. Before you plan your revision, you must know what the exam wants from you. The MRCOG Part 3 is a practical exam with 14 tasks. Each task lasts for 12 minutes. 2 minutes is given to prepare and 10 minutes to perform. Tasks are mapped to 14 modules of the curriculum and test you across 5 domains: information gathering, applied clinical knowledge, patient safety, communication with patient and relative, and communication with colleagues. There are 2 main types of tasks. One is simulated patient task where you interact with the role player. That could be a patient, partner or a colleague. The other is a structured discussion where you speak directly to the examiner about management, ethics or safety. Some circuits now include a linked task, for example counseling in one station and management in the next, or even writing components where you may summarize management or fill a note. In short, it's not about remembering facts, it's about showing safe, structured and empathetic clinical behavior. Now coming to the last 2 months revision plan. In the first month, build your foundation. Your goal here is to cover all the 14 modules once and build templates for answering stations. Each week cover 3 to 4 modules. For example, in the first week cover early pregnancy, antenatal care and maternal medicine. Practice 3 to 4 stations daily. In the second week, you can cover teaching module, postpartum, labor and delivery. Practice your language for emergency situations using SBAR tool. In the third week, cover post-op care, surgery and gynae module. In the fourth week, cover the rest of the topics: subfertility, sexual and reproductive health, gynae onco and urogynae. Finish this week with full syllabus overview. By the end of week 4, you should be able to talk through all the major topics without reading. Focus on speaking clearly, not memorizing. Now in the last 1 month, practice and polish. Now it's time to act like you are in the exam. In the first week, do 2 to 3 stations per day. 1 simulated patient task, 1 structured discussion and 1 teaching station. Record yourself, check the tone, structure and time. Listening to yourself is uncomfortable, but it's the fastest way to fix gaps. Also practice with a study partner or in groups. Now in the next week, do a full mock circuit of 14 stations under exam timing. Review every station with feedback across the 5 domains. Identify your weak points and focus on those areas. In the last 2 weeks, do light revision only, 1 to 2 stations daily, mainly for fluency and confidence. Here's how your daily study plan should look like. In the morning, read guideline or module. In the afternoon, practice 1 to 2 stations aloud. In the evening, review feedback. On weekends, simulate a mini circuit of 4 to 6 stations under timed condition and have 1 rest day to avoid burnout. Now let's practice some communication skills. Start strong. Hi, I'm Dr. Sana Ansari, one of the doctors in the antenatal clinic today. May I confirm your name and age, please? How would you like me to call you? Build rapport. I understand this must be worrying you. Let's go through everything together. Use ICE technique. What are your thoughts about it? What's going on? Is there anything specific you are worried about? Simplify your explanations. Avoid layman language. Shared decision making. Now here are all the options. Let me explain you the risk and the benefit and we'll decide together what's best for you. Never forget patient safety. For example, drug allergies. In case of abnormal uterine bleeding, if you experience heavy bleeding or pain, please come to the emergency immediately. For communication with a colleague, use the SBAR tool. Situation, background, assessment, recommendation. Practice these lines until they sound natural, not robotic. That's what gets you marks under communication and patient safety. Now let's talk about your final week and exam mindset. Don't touch new topics, revise flow charts, do light mocks just to keep a rhythm. Sleep 7 to 8 hours daily. You need mental clarity, not cramming. On the day of exam, arrive early, stay calm and remember, each station is a fresh start. Read the task twice. Underline the objective. Write patient name and age on the top. Think structure, introduction, information gathering, management, patient safety and summary. If you get stuck, pause, take a break and redirect. Examiners are looking for safe thinking, not perfection. After each station, let it go. Don't carry mistakes forward. Your goal is simple. Be calm, be clear and be safe. Remember, you have already done the hard part in part 2. Part 3 is your opportunity to show how you think, how you communicate and how you keep your patients safe. You don't have to be flawless, you just have to be structured, empathetic and professional. So believe in your profession, stick to the plan and practice speaking every single day. Let me know in the comments if you'd like a video on top 10 common part 3 stations. Thank you. All the best.